Conveniently located on Route 16 in Newton, Massachusetts, is the Mass General Cancer Center at Newton-Wellesley Hospital. Easily accessible from the Mass Pike and I-95, we are honored to serve the community. Upon arrival, you may valet park your car. At the front desk, you will receive a $4 valet voucher. It is a good idea to have someone drive you on your first treatment. We recommend wearing comfortable, loose-fitting clothing. As you enter the doors, walk through the waiting room up to the front desk. Check in for your appointment and remember to ask for the valet voucher. You may take a seat in the waiting room. If you have a lab appointment, you will be called to either the phlebotomy room or the treatment room to have your blood drawn before your provider visit. You may return to the waiting room until further instruction is given. Shortly, you will be escorted to your appointment with a provider in an exam room. This may be in person or virtually on a video monitor set up by a medical assistant. A doctor or nurse practitioner will complete a physical and emotional assessment at each visit. They will assess your symptoms and clear you for treatment. A medical assistant will weigh you and take your vital signs. Remember, it is very important to check back at the front desk after your provider visit prior to seeing nursing. Next, you will be given an identification bracelet as you are called to the infusion suite. Our recliner chairs are equipped with heat and massage for your comfort. They are sanitized between patients and are separated by 6 feet with partitions for privacy and social distancing. You may be assigned to a different chair at each visit. We try to keep your nurse consistent, but occasionally you may be cared for by other nurses. Our mission is to care for all patients as we would a beloved family member. We want you to feel comfortable, welcomed, and safe. While you are at your provider visit, your labs will be processed. Treatment typically cannot begin until the labs are resulted. Your chemotherapy dose will be adjusted based on your labs, weight, and how you are feeling. Once the orders for your treatment are written, 2 nurses and 2 pharmacists will verify the orders are accurate. The pharmacy technicians can then begin making your medication. This careful process can take up to 90 minutes. Most treatments are infused through a vein. This can be done through an IV catheter or surgically implanted access device such as a port or a PICC line. You will be told which method is recommended for you. Your nurse will review your medications with you during an education appointment. You will be given a folder with information sheets specific to your treatment. Your provider may call in prescriptions to your pharmacy for home medications. These will be reviewed with you at your visit. When administering some treatments, it is required for nurses to wear protective gowns and gloves. Before receiving any medication, you will be asked to verify your name and date of birth. 2 nurses will verify each chemotherapy and immunotherapy prior to treating you. Infusion time may vary based on your specific treatment. You may choose to bring books, tablets, or laptops for your entertainment. There will be free Wi-Fi to connect to. You are welcome to bring your own food. We do have light snacks, beverages, and warm blankets. You will be monitored by nursing throughout your treatment, and you will be given a call button if you need assistance. It is important to communicate how you are feeling to your nurse during your treatment. With each visit, a nurse will do an assessment of any symptoms or side effects you may have. Once your treatment is done, the nurse will explain the next steps. An administrative assistant will call you to set up your follow-up visits. The contact number for the Cancer Center is 617-219-1230. You may call this number to set up appointments, report problems or concerns, and get prescriptions refilled. A nurse is on call from 8:30 in the morning until 4:30 in the evening, Monday through Friday. A physician is available through the answering service on nights, weekends, and holidays for urgent calls. We also have an integrative support center, which has social workers, psychologists, dietitians, nurse navigators, support groups, Reiki, and massage therapists. Feel free to ask for more information regarding these services. As safety is a priority, Mass General Cancer Center at Newton-Wellesley Hospital has implemented special precautions during the COVID-19 pandemic. As you enter the lobby, you will be asked to sanitize your hands, screened for any COVID-19 symptoms, and you will be given a new clean mask. You must wear your mask while you are in the cancer center unless eating or drinking 6 feet away from other people. Visitors require prior approval. Contact the office if you require a support person to be with you during your visit. Interpreter services are available at no cost. While you are a patient at the cancer center, you will have a mix of in-person and virtual visits with a doctor or nurse practitioner. If you have a virtual visit with a provider, a medical assistant will set up a video monitor for you in the exam room. After your visit, return to the waiting room and let the front desk know you have completed your provider visit. If you do not require treatment, you may have the option to do a virtual visit from your home if you have the technological capability. All of the chairs and equipment are sanitized in between patients. Chairs are 6 feet apart with partitions for social distancing. All staff members wear masks and eye protection during patient interaction. Starting treatment may feel scary. It is our pleasure to care for you throughout your time at the Mass General Cancer Center at Newton-Wellesley Hospital. We hope you feel supported, and we are looking forward to meeting you.